CHAMPS Kenya is implemented by the Kenya Medical Research Institute. It works very closely in close collaboration with the Ministry of Health, and we operate in Kisumu and Siaya counties. We do sample collection through a minimally invasive tissue process as opposed to the classical autopsy where the body is opened. For CHAMPS, we use MITS where you go in like with a needle, just get a very small tissue sample, and then you subject that to an expansive level of testing. Really advanced tests are conducted.
I would say CHAMPS start from the community, where we have to go out and explain to community members. And when I say community, I use it broadly also to include health facilities, because those health facilities are also based within community. So we explain to community members what we want to do and how we want to do it and how it will impact their lives. So then we explain to them the procedures. As that's where death notification occurs, because we get death from community as well as from the health facility.
Kenyan CHAMPS program, as designed, has different departments. We have the Mortality Surveillance Department that deals with consenting. Thereafter, there is the Pathology Department, under which the MITS van falls. The MITS van, as it's called, it's a van that was developed to enable us to do minimally invasive autopsies within the community, so as to mitigate on the quick turnaround time of doing postmortems. This is where we perform MITS for the disease cases that are consented. And while doing MITS, which is minimally invasive tissue sampling, we collect both tissue and non-tissue specimen.
The organs that we target are the liver and the lung. And then we collect blood sample, we collect cerebrospinal fluid, we collect rectal swab stool samples. And all these samples are then brought to the lab, and then they are received in a section where the samples are accessioned. Once they have been received, the samples are then taken to different testing laboratories. The blood samples are also tested using Tuckman array card. We use multiplex PCR platform, and the TACAD array simultaneously detect a number of infectious pathogens. And for the CHAMPS, we target close to 48 different infectious pathogens using these TACAD platforms. And once the testing has been completed in all the lab, the results are then collated together and taken to the case files.
You combine all that with clinical data abstraction for whatever that took place ante-mortem before the death of the child. What was the treatment? How was the child ailing? All that data collected is packaged and presented to a panel of experts.
When a decode has been done and we have got decode findings, we get this to the family so that they need to know what really happened that killed their children. We give them the specific findings of the decode, that is the cause of death, and the preventable measures that they need to take in order to prevent such kind of deaths and also stillbirths.
That day by day ni kuconverse, ndio aliconvulse. Na tulipompeleka Nightingale tukaambua twende tutafute damu. Na damu sasa ni Good Friday. Hakuna mahali tunaweza pata damu. Mtoto tunaambua amekuwa sedated, na sisi tumekaa hapo, kumbe mtoto alienda mapema. They were just asking us, kwa nini mlingoja mtoto akue hivi? Ndio mumlete. Kwa nini mlingoja mtoto? You know, it's painful. But tulienda tukazika with the help of CHAMPS, wakatupeleka, walitusaidia. The team that was determining mtoto nini inaweza kuwa iliwa mtoto was pneumonia, between pneumonia and gastritis. So they explained to me all that. Nikaelewa na nikakubali.
The research we have been doing with CHAMPS is on child mortality. It has been able to show us what is the major cause of child mortality in the Western Kenya, or the region that you have been working in.
That information goes a long way in helping us to plan for health services based on the information we collect from CHAMPS.
We have worked with them in regards to development of our pediatric death audit, issues related to child health data, discussions when it comes to child health mortality, and mapping out of different pathogens that are related to child health.
It is important for these mothers to know what is killing their children, to know what is causing their stillbirths, and we help them to get to know what can be done better to prevent such kind of stillbirths and such kind of deaths. And we have to build a healthy and a better nation.